Thank you for listening to Depictions Media Radio. Welcome back to Depictions Media Radio. I am your host, Michael Clogs. In the Americas, the region itself has seen over 7 million new cases of COVID-19, with more than 3,400 COVID-related deaths. How this is a rise in infections, everything does seem to be slowing down after being hit with the Omicron variant. The largest surges were seen in Central and South America, where Chile and Brazil posted record numbers. The deaths increased in the fourth consecutive week in all the subregions, showing an increase of 33% over the previous week. And the director of PAHO is, of course, going to go on and say that thanks to the effort of hard-fought efforts in the countries of the Americas and generous support donations from the United States, Canada, and Spain helped the region secure doses when supplies are limited, for 63% of people across Latin America and the Caribbean have been fully vaccinated now. So, as we know, of course, here in Canada, that we're probably closer to 90% completely vaccinated and boosted at this point. So PAHO is continuing the efforts to make sure that vaccine equity is seen across both North and South America, and they're going to continue their efforts also because there are other conditions that have taken a rise because of the lack of the ability to travel with COVID-19, and it has hindered some shipments of medical supplies, where still during this pandemic they have seen a rise in underdeveloped countries of diabetes, tuberculosis, and other things that were actually pretty much under control in those same exact regions. So let's listen to what Dr. Etienne and her team actually have to say in this next segment about COVID-19 and the health of.
Let me thank you for joining today's press briefing. COVID infections and deaths in our region remain on the rise, and hospitalizations and ICU admissions have continued to increase in all subregions. Last week, the region of the Americas reported more than 7 million new COVID cases and more than 34,000 COVID-related deaths. However, the rise in infections seem to be slowing down in places hit earliest by the Omicron variant. Most of the new cases were reported in North America, which saw more than 4 million new infections. Surges continue across Central and South America, where Chile and Brazil posted record numbers of daily cases. Deaths increased for the fourth consecutive week in all subregions, showing an increase of nearly 33% over the previous week. In the Caribbean, deaths have more than doubled in Cuba, the Bahamas, and Antigua and Barbuda. Other islands like Martinique and Guadeloupe are seeing COVID spread rapidly among young and unvaccinated people. These trends show that we must continue to sustain every part of our COVID response. vaccinations, testing, and continuing public health measures like mask wearing and social distancing remain crucial. Today, I want to offer an update on one key component of our region's COVID response: vaccinations. Thanks to the hard-fought efforts of countries throughout the Americas and the generous support of donors like the United States, Canada, and Spain that helped our region secure doses when supply was limited, 63% of people across Latin America and the Caribbean have been fully vaccinated against COVID-19. Thanks for all of those who helped. Our region has some of the highest COVID-19 vaccination coverage in the world. However, the Americas are the most unequal region in the world. And so despite our progress, vaccination remains uneven in Latin America and the Caribbean. A worrisome sign is that today, more than 1 in 4 people across the Americas have yet to receive a single dose of protection. While 14 countries and territories have fully immunized 70% of their populations, the same number of countries have yet to protect 40% of their people. And if we zoom in on low and middle income countries in our region, more than 54% of people have yet to receive a single COVID-19 vaccine. We also have serious blind spots because we can't see detailed vaccination data. We encourage countries to collect and report data showing vaccination coverage by age, sex, and by risk group when possible. Without these numbers, we won't know what proportion of high-risk groups like the elderly, pregnant women, or health workers have been protected. These data are crucial to designing targeted vaccination campaigns, maximizing the impact of vaccine doses, and of course, saving lives. In countries that do report detailed data, we see worrisome gaps. For example, in the United States and in Angola, vaccine coverage among the elderly is lower than in younger groups who are less at risk for severe COVID disease. The good news is that vaccine supplies are expected to pick up this year. Donations from the United States, Spain, Canada, Germany, France, and other countries total some 26 million doses. We register our thanks to all of those who have donated. PAHO's revolving fund, which so far has delivered almost 100 million doses, is on track to obtain 200 million doses on behalf of our region this year. And thanks to the fund's agreements with vaccine manufacturers and the support from all of our partners. Due to the rapid scale-up in purchases, donations, and COVAX deliveries at the end of 2021, progress was made on ensuring access to vaccine supplies, and countries will have enough stock to implement mass rollouts. So countries will be able to offer vaccine doses to those who remain unprotected. As these doses arrive, we urge countries to make the necessary preparations to make the most of these vaccines. And that starts with collecting and reporting stratified vaccine data. We urge countries to reanalyze their vaccination data to better understand their gaps, whether that's in geography, age, sex, or among key priority groups. If countries are already collecting this data, we urge them to share it with PAHO. And if they are not yet collecting that data, PAHO is here to support them. We urge countries to prioritize high-risk groups. Countries should refocus their efforts in protecting health workers, immunocompromised individuals, and the elderly first. If they don't, they will continue to experience outbreaks. Their hospitals will remain overstretched, limiting care for other conditions, and too many people will continue to die from this virus. Once countries have secured high coverage with primary series and booster doses among these highest priority groups, PAHO recommends that they retool the vaccine rollout plans to focus on the next highest risk groups. As coverage in these priority groups grows, we will see reductions in the national hospitalization and mortality rates. It is at this moment that vaccine doses should be made available to healthy adults, as well as adolescents and children aged 12 or older who may be living with pre-existing medical conditions, so we can further reduce transmission rates. Healthy children and adolescents should be the last to receive COVID-19 vaccine doses, since they are at the lowest risk for severe disease. But we remind countries that the best way to protect the well-being of our children is to safely reopen schools. Childhood vaccination is not a prerequisite for safe school reopening. And finally, this is also the time for countries to invest in their vaccination programs. We urge countries to bolster their cold chain capacity to absorb incoming supplies. Countries should hire and train enough health workers to deliver COVID vaccines without sacrificing staff for other essential services. And countries should have plans to reach those living in hard-to-reach areas, both in rural zones and in parts of cities, because they are too often the last to receive care. Many places, especially in the Caribbean, also lack robust vaccination programs for adults. So it has been challenging to ensure high coverage among other adult populations. Now is the time to strengthen vaccination campaigns, organize vaccination drives, and empower key groups like health workers and religious leaders to become vaccine advocates. Reaching high vaccine coverage depends on all of us. So I want to send a special message to the millions of adults in the Caribbean who have yet to receive their COVID vaccines. Let me share a little about myself. I'm a medical doctor, a wife, a mother, and grandmother. And let me tell you that I could not wait to get my vaccination. I was so anxious for the well-being for myself and my 95-year-old mother who lives with me. And I can't begin to tell you the relief that I felt when I, my mother, my husband, and my children were vaccinated. And that is because I trust in science and I appreciate life. So please, don't delay. Get vaccinated today. COVID-19 vaccines are safe and effective, and they are the best way to protect ourselves, our families, and our communities from this virus. We cannot get back the time that we've lost to this pandemic, but we can control how the future will go. Returning to family traditions, cultural celebrations, and the moments that make life precious requires that we get vaccinated. Vaccines work, they are safe, and they can help us end this pandemic. So please, go get your vaccines today or as soon as you can. Thank you so much.
Thank you, Dr. Tien, for those words. Pasamos ahora a las preguntas.
Now we go to the questions that have been sent by email and that we are receiving through the Q&A button. We begin on the topic of vaccine.
From several media on this next target in the fight against COVID is reaching 70% vaccination globally by mid-2020, a target set by the WHO. What is PAHO doing to support countries in these efforts to vaccinate, especially the ones mentioned in the statement that are very far from these goals? Dr. Etienne?
So let me thank you for that question that allows me to share some of the work that PAHO has been doing with regards to vaccination. We have been fighting to gain access to doses for our countries since the first COVID-19 vaccines were approved. And we continue to support our countries in every facet of the vaccination program. We have a regional plan of action to ensure sustainable access to these vaccines. And we are working with manufacturers, other agencies, suppliers, and the private sector to get as many vaccines, syringes, and other supplies to as many countries as possible and as quickly and efficiently as possible. So the good news is that global production capacity has ramped up and may go from 10 billion doses today to 35 billion doses by the end of this year. So we'll be able to increase supplies to our countries. The PAHO Revolving Fund has been key to the success of our vaccination programs over 40 years. And we make things simple for countries by arranging everything from negotiation with suppliers to purchase at fair prices to delivery directly to the countries. And let me urge countries to keep making use of this mechanism. We also provide other help to countries through our strategic fund, which has agreements with 9 suppliers of syringes and other immunization supplies. Last year, countries bought some 654 million units of these. We work tirelessly with the Ministry of Health of each country to provide strong technical and financial support to increase vaccine uptake. So these efforts include strategic use of resources to reach the most vulnerable first, training for healthcare workers, extension of cold chain operations, and communications to inform the public, and the collection of best practices and lessons learned. Working together with the additional vaccine supplies we expect this year, and with the commitments from governments, people, suppliers, and others, I am confident that we can attain and surpass that 70% vaccination goal. But we must all work together to achieve this. Thank you.
Thank you, Dr. Tien. We stay with an English question from David Luno, the Latin American editor at the Wall Street Journal. David has 2 questions. The first is, given the huge numbers of people that have gotten infected with Omicron during the past month around the hemisphere and the world, can any of you think of a time in recent memory when so many people fell ill in such a short period of time? That's question number 1. The second, he asks, given that Omicron is less severe than earlier variants and so many people are getting infected, does it make sense to loosen guidelines for those who are asymptomatic, i.e. letting asymptomatic children stay in school or positive but asymptomatic health workers keep working, etc.? Dr. Ardigueri?
Thank you for this question. We don't actually need to go back much in time. And the H1N1 influenza pandemic that emerged during 2009 in the region of the Americas can serve as a very good example. The US CDC estimates that in the United States alone, during the 12-month period between mid-April 2009 and mid-April 2010, between 43 and 89 million people got sick, and that up to 400,000 hospitalizations and 18,000 deaths occurred. It is a hallmark of any pandemic, respiratory pathogen to spread rapidly and widely among populations in many countries around the world in a relatively short period of time. Regarding the second part of the question, and in the context of my previous comments, it is up to national authorities to assess the situation using a risk-based approach and adjust the public health measures based on the local conditions, including taking decisions for reducing the period of isolation for asymptomatic essential workers. These decisions are often driven by both the severity of the disease as well as the impact on healthcare services. I mean, mainly hospitalization and intensive care, and also its impact on the society as a whole. In addition, we need to qualify very carefully when we say that Omicron is less severe than earlier variants. There is not an agreement and definite conclusion among experts that Omicron causes a milder disease than previous variants yet. Even if it was the case, we need to consider that an uncontrolled transmission of a pathogen causing a less severe disease will still cause scores of cases, of which many can still progress to severe disease and death. Therefore, we would caution about describing the disease caused by Omicron as less severe and certainly not as mild. I hope I have answered the concerns of the journalist. Thank you.
Thank you, Dr. Altieri. Pasamos a una pregunta desde Nicaragua.
Now, Cynthia Torres from El Confidencial asks, in Nicaragua, we have the 5 concern variables circulating, including Omicron, which is the predominant one and which has been the impact of the variants of concern in the behavior of COVID in this country. Dr. Ugarte, thank you. Cynthia and Luciana. According to the latest official reports of Nicaragua through the IHR, there has been a weekly increase of 30% in the number of new positive cases. However, there are the trends are the same in the number of deaths. There is not enough information to determine which is the predominant variant in the whole country. Nevertheless, most positive samples of SARS-CoV-2 which have been sequenced correspond to the Omicron variant and in a lesser degree to the Delta variant. It is highly probable that the Omicron variant will be the predominant one and it will be present in the whole country as it is occurring in all the other Central American countries and in the whole region. It is necessary to remember that even though the Omicron variant causes less severe symptomatology, the increase in number of cases in a short term means that health services are overwhelmed, overextended, and in our region, at least 24 countries and territories have reported a significant increase in the number of deaths in the recent days. And this is why Nicaragua and other countries that are seeing increases in cases due to Omicron and other variants, people need to be aware of the need of maintaining the preventive measures that we all know, because we need to reduce transmission in all cases. We cannot lower our guard thinking that the Omicron variant is less serious and then we can just live it up. No. As I said, many countries are reporting increases in deaths, and therefore the responsibility is by all the population, and of course health authorities, to report cases that are occurring so that the population can be protected. But yes, community transmission is the responsibility of all of us. Thank you very much. Thank you, Dr. Ugarte. Now, question on the sublineage BA2 of Omicron. First question from Melina Ochoa from Uno TV, Mexico City. She has several questions, and we begin with the fact that the National Genomic Institute in Mexico described the first case of the subvariant, which is BA1, detected through a PCR test. What reports does PAHO have in this regard? Are there more records of this in Mexico? And the second question is that the federal health ministry said that Mexico had shown a decrease in the number of COVID cases, and so it's on the decrease. So, Dr. Aldeguerri, what can you say about this? Well, thank you very much for your questions. I'm going to answer the one related to Mexico in particular. Yes, in Mexico, as the health secretariat or as health ministry has reported, there is a trend to a downward trend in new cases. It went from 76,000 active cases to so it is a 24% decrease regarding detecting the BA2 lineage or sublineage in Mexico. Yes, the sequence has been reported in the world public platform in GISAID, and it was reported by the National Genomic Medicine, which is coordinated by INDRA. We are in close contact with health authorities who are analyzing all of this. Now, regarding the sublineages of Omicron, well, it is always important to remember that the evolution of the SARS-CoV-2 virus is a very dynamic process, and we are constantly evaluating this. To now, 4 different sublineages have been described for Omicron: BA1, BA11, BA2, and BA3. Globally, BA1 is the predominant sublineage. And in fact, among the sample sequence during the month of January this year in the Americas, BA1 and BA11 have been seen in 95% of samples coming from North America and in 87% of samples coming from South America and the Caribbean. In the Americas, up to now, we have official reports of detection of BA2 in Mexico, as I just said, and in Argentina, in addition to sporadic cases in the United States. And in our region, BA2 has been detected in less than 0.1% of the reported samples. And finally, let us remember that the introduction and spread of the several sublineages of Omicron is an expected event. And we will no doubt see an increase in its transmission and spread during the next few days and weeks. And it is necessary to take into account that it is one single variant. And at present, there is no reason to be concerned additionally because of this. Thank you very much.
Thank you, Dr. Aldeguerri. We have another question from Mexico, Blanca Valadez from the Millennium Group. She's also asking, could you please explain whether there is a difference between BA1 and BA2, the Omicron lineages, and also whether this could change the path of the pandemic? Could it, because it is more contagious or potentially fatal? Is it possible, or is there any intent to rename Omicron after the Greek alphabet? And do we have any estimate of the percentage of individuals that after infection suffered severe side effects and potentially disability? Dr. Aldeguerri, thank you. As I have mentioned in my previous answer, there is no solid evidence that shows a change in the clinical pattern or epidemiological pattern in any of the 4 sublineages that I have described before, the 4 Omicron sublineages. Therefore, at this point in time, there is no reason to believe that a specific sublineage could lead to greater number of fatalities. PAHO, WHO, continued to follow closely the studies on the behavior of the sublineages and the variants, and clearly we will be reporting timely on any change or impact on the public health. On the other hand, the classification of lineages and sublineages within the same variant is the result of a deep and profound analysis of the genetic material of the virus that allows us to clearly see any change that may emerge. And that is what is happening with sublineages BA1 and BA2. However, those changes are not enough to classify them as a totally different variant. Therefore, the classification remains as Omicron. Once again, the evolution process of SARS-CoV-2 is highly dynamic. We continue to study it, and we continue to monitor the situation from the advisory group on viral diseases, and this is the team that has been working on this for over a year now. So far, there is no solid evidence that shows any change in transmissibility, the clinical presentation, or the immune response among the sublineages beyond the ones already described for the Omicron variant. I hope I have addressed the questions to cover all of the nuances of that question. Thank you very much. Thank you, Dr. Aldigueri, for your clarification. There is a great interest in variants BA1 and BA2. We move on to another question from Argentina about masks. The question is, over the last couple of days, we have heard about full in-person classes. This is coming from Full Noticias in Argentina, and he's saying that to make that possible, we need better masks. What is the opinion PAHO has regarding this? Dr. Ugarte. Thank you very much, Agustin. This is a topic that is current in all of the countries and not only at the school level. It is all of the population, the one that is concerned about the best mask that offers the best protection against Omicron. Dr. Aldigueri has already mentioned this, but I would like to also highlight that the most important aspect is to wear a properly fitting mask at the right time whenever we are in public and we cannot maintain public distance, or in closed spaces where transmission may be more active. In Argentina, it is excellent that the public health authorities and the education authorities in Argentina are fully coordinated, and also with the support of their own experts from the Argentinian Association of Pediatrics and also PAHO and UNICEF experts to define the best way to return to schools in mid-February or a bit later. Clearly, schools are part of the community, and as we have seen in other occasions, whenever there was active transmission in the community, this is also something that we see at the school level. That's the reason why the measures implemented at the level of the community to reduce the risk will also reduce the risk whenever children go back to school. To that end, we have also indicated that the physical measures are also important at the school level, in addition to personal protection measures, the vaccination of teachers, and also wearing masks during classes to maintain, for example, the different shifts during breaks, so that also at the same time they can also take turns in having in-person classes and also virtual classes. this could all help reduce transmission. The use of masks is something that is being assessed based on, for example, a KN95 or a surgical mask would be enough for students. At this point in time, we continue to recommend for the surgical surgical mask or the medical mask is the one that affords proper protection when properly fitted. Also, in particular in areas when and in situations in which the mask is worn at all times, the measures to be applied also need to go hand in hand with the rapid detection mechanisms, the protocols, and also assistance, for example, offered to students that may have some symptoms or whose family members have had some symptoms. And in addition to early detection, they need to implement isolation and quarantine. And we said this several times, we should not stigmatize or children that have symptoms and positive COVID cases. The truth of the matter is that we need to encourage individuals that have symptoms or that have a positive COVID-19 case within their family. They need to communicate it. They need to be appreciated for that. And the same applies to schools. Schools work better if they report and if they implement the measures to protect children and the community. That is, once again, everyone's job. Thank you. Thank you, Dr. Ugarte.
Antoine Smith from ZNS News in the Bahamas asks, the vaccine uptake rate in the Bahamas has dropped off significantly, despite hospitalization consisting of mostly unvaccinated people. How do we drive persons back into vaccination centers? Dr. Barbosa?
Thank you. Thank you for this question. I think that is a very important topic because we have 90 countries in the Caribbean that are still below the 40% coverage. That was the goal to be achieved by the end of 2021. So this is due to several different reasons, but the vaccine hesitancy is certainly playing a very important role. PAHO, working with the Ministry of Health, we had a survey last year showing that many health professionals were not well informed about the vaccine against COVID-19. We had another survey that was performed by UNICEF recently showing that the vaccine hesitancy is very important in many countries in the Caribbean, and that the doctors and nurses are the most trusted source of information for the families and communities. So we are working with the ministries of health in the Caribbean to develop a comprehensive communication strategy in order to mobilize the healthcare workers, the communities to get the vaccination. The Caribbean countries have been very importantly affected by the pandemic, the tourism and other economic activities, and the best way to recover faster is to get people vaccinated. As the director said in her initial remarks today, the vaccines that we have are not the experimental vaccines. These vaccines were assessed by stringent health regulatory authorities and by WHO. We have now only in the Americas more than 1.5 billion doses that were already used. We have a strong surveillance system that are monitoring any unexpected side events related to vaccines, so we can reassure people that these vaccines are safe and these vaccines can save millions of lives. So it's very important working together, the Ministry of Health, the Association of Health Professionals, academic institutions, community leaders working together to bring the right information to the population in the Caribbean countries so we can have these figures related to the immunization coverage increasing very fast in next weeks. Thank you.
Thank you, Dr. Barbosa. Pasamos a una pregunta.
Now we move on to two questions. From Venezuela, Kevin Arteaga from El Carabobeño is asking, in connection with the reemergence of diseases that were eradicated as a result of a decrease in the vaccination campaigns against those diseases, could we offer an opinion, a general overview about that situation in the specific case of Venezuela? Dr. Barbosa, thank you very much for this question. One of the negative impacts of the pandemic, in addition to the direct impact, is the impact on some priority vaccination programs. We had a reduction in the region in vaccine coverage because of transmission, health services were closed, or health professionals had to be moved from the primary care centers to ICUs, to hospitals, and also because individuals were afraid to go out and go to one of these vaccination centers. As our director mentioned last week, this could be a very important risk, so that diseases that have already been eliminated in the region of the Americas may come back again. So we are working with the Ministries of Health to support strategies to go to every single home to try to find those individuals that are not vaccinated so that we can vaccinate them. As to the region, we use the third dose of the diphtheria, tetanus, and whooping cough vaccine as an indicator to determine vaccine coverage. The idea is, or the goal is, to cover at least 95% of the individuals. In 2020, 26 countries and territories of the Americas did not reach the 95% that was the goal, and 14 countries had the coverage with the third dose of below 10%. There is a clear risk, and we need to work on three pillars. First, we need a very sensitive surveillance that allows us to identify whether there is any importation of a case of a disease that has already been eliminated in the Americas. Second, the identification of outbreaks so that we can have a rapid response. And also we need, as another pillar, vaccine coverage throughout the districts, throughout the neighborhoods in the country, so as to reach the vaccine coverages that are important in Venezuela. We had an important measles outbreak between 2017 and 2019. With the support of the Ministry of Health of Venezuela and the society and also the local government, we were able to vaccinate 8 million children in Venezuela. And as of 2019, the transmission of measles was interrupted in Venezuela. But if we do not have the proper vaccine coverage on an yearly basis, we always risk the importation of new cases. We also have the situation of yellow fever that had an important outbreak starting last year in Venezuela. PAHO has mobilized 4,787,000 doses against yellow fever to be used in Venezuela. And we are in the process of mobilizing 1.7 million so that all of the population that is at risk of yellow fever can be vaccinated in Venezuela. So this is always a risk, and this is what requires proper surveillance with the proper vaccination coverage. And these are the only ways we have to prevent diseases such as polio, measles, diphtheria, and others that may lead to important outbreaks in our countries. Thank you. Thank you very much, Dr. Barbosa. Kevin has a second question. On the other hand, The bioanalyst trade union in Venezuela warned on Monday that there is underreporting of positive cases of COVID-19 in the country. Do you have any information on the number of tests that are being implemented in the country daily or weekly? Dr. Ugarte, thank you. Venezuela moved from confirming 110 cases, positive cases of COVID at the beginning of this year to confirming by February 1st, more than 1,800 cases. The National Health Institute of Venezuela reported to PAHO that they have enough PCR tests as well as antigen tests for the time being. We are aware that the processing sites for those tests at the private and public levels are overwhelmed, and PAHO has recommended to optimize the use of those tests to avoid lack of tests, as we have seen in other countries, since the overwhelming of the labs without a need, and also the global increase because of Omicron or because of people's travel, have diminished the possibility of buying tests, and at this point in time it is more difficult to obtain more tests, and within that context it is important to have some balance in the application of the test throughout the countries. We have information that the public health sector in Venezuela has the ability to process 5,000 PCR tests, and as to the antigen tests, even though we do not have a specific breakdown, the application of the tests ranges between 4,000 and 5,000 daily. Within that context, we should state again that the population has to protect themselves to avoid transmission, but at the same time, the detection systems need to adapt themselves so that they do not overwhelm the lab systems. Thank you. Thank you, Dr. Ugarte. Now we move on to a question from La Prensa Panama. Mr. Cardenas, what are the recommendations for Panama at a point in time when it seems that cases are going down so that we can avoid the fifth wave or a new outbreak? Dr. Barbosa? Thank you. Thank you very much for this question. I think that the question itself gives us a good idea of the answer. We already had 4 waves. There is fear in terms of a 5th wave, because even when cases are going down, it doesn't mean that the pandemic is coming to an end. It is very important to continue first with vaccination and to see the groups among the most vulnerable ones that have not been fully vaccinated. In many countries in our region, there is an important gap between the first and the second dose. That is to say, individuals that were only vaccinated with the first dose, and we have ample evidence that just 1 dose is not enough to protect those individuals. Then we need to look among the elderly individuals that have cancer, hypertension, diabetes, pregnant women, all of the most vulnerable groups. We need to see those that need to be protected, because if there is another wave, their lives will not be protected. And also it is very important to maintain surveillance on what is going on, and it is not only as to the number of cases, because when the number of cases goes up at the hospital level, the reason is that there is already significant community transmission. So we need to have all of the epidemiological indicators to see how the positive rate, the positivity is playing out, and also the surveillance in terms of the number of hospitals and emergency rooms to monitor what is going on. Because whenever there is community transmission, there can also be an increase in the number of cases and death. It is also important, in my opinion, that we maintain the measures, in particular, the measures that may protect individuals, such as the wearing masks, in particular whenever individuals are indoors or using public transportation. That is, individuals that wear masks, or by wearing masks, we can reduce transmission to avoid also large numbers of individuals in the same place. There are several measures that can be followed. It is important to note the effort made by Panama and also all of the measures implemented by the government and the population, the reduction in the number of cases. But once again, it doesn't mean that the pandemic is over. We need to continue with surveillance, with vaccination, and also with the measures that can prevent the disease, the infection. Thank you very much. Thank you, Dr. Barbosa. We move on to a question from the Caribbean.
Celebrations, which interesting for several countries in the region. From the Montserrat reporter, Jennifer asks, for countries with small population size and health systems with limited resources, given the extended nature of the pandemic, is it now okay to have festival or carnival celebrations, keeping in mind economic, social, and mental health factors? Dr. Ugarte?
Thank you, Luciana. Jennifer, all countries in the region have been advised to refrain from organizing mass gathering without a proper risk assessment, particularly in relation with the epidemiologic situation and the availability of health services. But we need to recognize that there are different drivers and risk tolerance of mass gatherings, that it is critical to consider the epidemiologic context, particularly the prevalence of the new variants, including the Omicron, the strength of the transmission, as well as the capacity to contact tracing and testing capacity. I already mentioned about the availability of tests and how the tests are being applied and the reduction of the availability at the global level. So it is much advisable that when we assess the situation and then we plan properly how these events may be organized and all the measures that have been need to be in place. It is also to adjust all the responses according to the local situation, that it may be different from other situations. So all the public health and social measures must be implemented in accordance to this risk assessment. The use of masks, for example, as we mentioned, the physical distancing, the hand hygiene, and improving the ventilation of indoor spaces remain key to reducing the transmission of SARS-CoV-2. So in general, the application of the quarantine and isolation measures are also key, particularly when we have symptomatic persons, but also when we have contacts that have been confirmed of COVID-19. So the decision-making process must be a balance between what we are seeing in the health sector and what is the other sectors also need to be active. We've seen, for example, that because of the high level of transmission, even the tourism and critical sectors lost their workers. And the consequence is even a higher impact on the economy. So those are the type of aspects that we need to consider, particularly on mass gatherings. That doesn't mean that we will cancel all of the events. We must assess the situation and implement and plan properly so the communities also will have some spaces to reduce the impact on their communities and their social networks. Thank you.
Thank you, Dr. Ugarte. Una pregunta desde...
This is a question by Chris Vilches from El Comercio in Peru on the vaccines. He's asking how many vaccines has COVAX sent to Peru out of the 13.2 million that were committed, and the Minister of Health said that Peru does not need those vaccines that are delayed and that they are resorting to other bilateral contracts that they have to cover their needs, and has PAHO, for example, thought about donating the additional doses that are no longer needed in countries such as Peru to Africa?
Thank you for the question. This is Dr. Barbosa. Peru has received about 1.18 million vaccines. PAHO did receive information. This is an important sign of solidarity. Peru already has the necessary vaccines, and in addition to COVAX vaccines, they also have vaccines from bilateral agreements, and we are also establishing contact with those countries that have the intent of receiving the vaccine. We are putting them in contact with Peru. PAHO offers technical cooperation to all of the countries as to how the donation processes need to take place in terms of good quality, so that vaccines can be taken from one country to the other to preserve all of the characteristics of the vaccines. This is a very important solidarity gesture by Peru, and this may help all of the countries to have more equitable access to vaccines against COVID-19 in our region. Thank you. Thank you, Dr. Barbosa. We are reaching the end of our session. We have one more question.
A final question for Dr.
regarding
Etienne.
vaccine.
On the topic of vaccines, Dr. Etienne, you recently mentioned routine vaccines in children had dipped in the region because of the pandemic. How serious is the situation in the region, and can you give us more details about these decreases?
So thank you for this question. And in answering this question, I want to refer you back to the response that Dr. Javas gave, Dr. Javas Barbosa, our Assistant Director, gave earlier to this question, where he actually mentioned numbers. So let me say, you ask if it's serious, I think it is. The region of the Americas, we have faced numerous public health emergencies. And our expanded program on immunization, which we refer to as EPI in the Americas, has reported additional setbacks in our routine vaccination and surveillance performance, reaching a 10% decline in diphtheria, tetanus, pertussis, which is our DTP3, which Dr. Barbosa referred to, over the coverage for that vaccine in the last 10 years. Let's say that despite the tremendous achievements of our immunization programs in past decades, that progress has stalled. In some countries, even reversed in this region. And that places our achievements at risk. We are at very high risk of new and re-emerging outbreaks of vaccine-preventable diseases because of our lower immunization coverage. We have seen measles circulating in more than one country years after we had eliminated it. Our regional technical advisory group has alerted us that based on their assessment of polio vaccination, that the region is at risk for reintroduction of polio. I think this is serious. Our health ministers have set out a strategic framework for revitalizing immunization programs in the region of the Americas. And PAHO is working with them on this urgently. Reinvigorating countries' routine family immunization programs is among one of our highest priorities. You've heard it over and over again that immunization is among the most cost-effective public health strategies that is available. And beyond its immediate health benefits, it does provide a high rate of return on investment for the entire community, resulting in contributions both to the socioeconomic development and the educational attainment well beyond the cost of the vaccines themselves. It is true that the ongoing COVID-19 pandemic has put an additional strain on our national immunization programs and our healthcare systems, resulting in the redirecting of considerable resources to emergency response operations. But I would say that we are at a juncture where it is urgent to look at our routine immunization programs. PAHO's priority is to ensure equitable access to COVID-19 vaccines, as well as the consistent access to vaccines for routine immunization for all people in this region. I'm afraid that failure to act now will result in outbreaks of measles and other diseases like polio, which will further damage lives and economies. So let's work together. Member states, the health systems, immunization programs, and families, please let's work together to ensure that our routine immunization programs are delivering the vaccinations to all of our children and family members. So let me thank you again for joining us in today's press briefing. Thank you for the many questions that you've asked, very relevant and important questions, and we look forward to seeing you again next week. Thank you.
Thank you.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.